talking about creating agreements for assisted living facilities. These are something that is definitely important if you're going to be providing services within those type of communities, right? Those assisted living facilities. So that's what we're going to be talking about in this video at this very moment, and why it's such an important thing, okay? Now, let's go ahead and get started. So, being that in-house preferred provider for independent and assisted living communities, these are the arrangements that you're going to be able to garner a nice steady flow of patient referrals for your company, okay? In addition, when creating these arrangements, they can be profitable, but at the very same time may cause some problems for you as well. So what I want you to do is heed these warnings. The arrangements that you're able to make with these potential facilities, with these potential referral sources, these independent living communities, these assisted living communities, it may be scrutinized as well under federal and state anti-kickback laws. If your agency is receiving Medicare payments, Medicaid payments, or any other federal payers, okay? Now, I want you to remember violating the federal anti-kickback laws can result in a $25,000 fine, possible 5-year imprisonment, or even both. You can also be barred or not allowed to participate in the future in other federal healthcare programs. Crazy, right? The federal anti-kickback statute prohibits any kind of rewards or compensations in exchange for referrals of some clients covered by the federal healthcare programs. If you are going to be that preferred provider of that independent living facility or assisted living community, understand that it does not guarantee anything that you will serve all of its residents, okay? The advantage of being an in-house preferred provider is that your company will always be there and therefore will have plenty more opportunities to be able to take the cases, to be able to get those referrals from that particular community. Despite any challenges and any problems that may arise, understand that it's not illegal for any private duty, let me repeat that again, private duty agency to be that in-house preferred provider for any independent or assisted living communities, as long as your relationship with those communities abide by the law, okay? Let me go ahead and share with you guys 2 tips that should help you successfully maintain relationships within these communities and to ensure that you generate referrals. 1, you need to always be prepared for competition from other independent contractors within that facility who can either underbid your private care agency. At the same time as residents prefer independent contractors because their rates are going to be a lot cheaper than yours. You're going to have to be able to differentiate yourselves and also promote your agency's advantage and what you have to offer more than the other companies, and to be able to show them what you're charging is worth more than what you are providing. I will discuss with you guys in future videos on how to be able to still charge a good rate for your private duty services without having to lower your rates. One of the biggest things to do is you can keep your rates, but provide more valuable services, more valuable products that are offered to be able to show your future clients, their family, as well as the facility that you're servicing, that your company provides more than the rest of the competition. A good example is this. When we provide services for a lot of assisted living facilities, what we do is we provide a medication reminder program, because most of the time is the patients are not being taken care of 24/7. So there are times in the afternoon, for example, if we're providing morning services, that we're not going to be with that particular patient or client. So what we would do is every day at 5 o'clock in the afternoon, they will receive a call from our company to remind them to take their medications. You guys have to understand, Medication noncompliance is one of the biggest reasons why a lot of patients end up in the hospital. So, by us being able to make sure that the clients are being reminded to take their medication, it makes us stand out from the other agencies. Because I can guarantee you that 99.9% of other agencies out there are not calling patients on a daily basis to remind them to take their medications. So, what other things can you add to make yourself more valuable? There are so many different things that we're going to be sharing with you guys through this whole series, through this whole training, because our main goal is to be able to give you guys all the knowledge that you need to be able to beat the competition. Always remember one thing, that marketing in home health is easy when you know what you're doing.